Thank you for giving me this opportunity to present this pilot trial. These are my investigators. A couple of them are actually sitting in the audience, which is encouraging. So I'm going to talk about the background, why hypothyroidism and vitamin C, the objectives of the study, the methods, our results, first phase and the second phase, and conclusions. So we all are here because we know thyroid is a problem. Hypothyroidism can affect up to 250 million individuals worldwide. Up to 5% of individuals can have overt hypothyroidism, and 10% can have subclinical hypothyroidism. But in the Gulf, we don't have a prevalence study, but we have cross-sectional studies, somewhere between 5 to 10%. And we treat them with levothyroxine, which has a sodium moiety change structure from thyroxine, and you can give up to 1.6 micrograms per kg body weight. But when you start levothyroxine, 50% of patients may not have a normal response, and you may need repeated testing, repeated increase in dosing, and that has financial implications. Why vitamin C is relevant to that? Well, vitamin C, discovered as ascorbate a century ago, then labeled as vitamin C. We need about 200 milligrams per day. We can have up to 1 gram. Adequate levels are more than 50, and when you have less than 11, you get scurvy. We only have 2 months worth of vitamin C storage in our body. That's why the sailors used to get scurvy. Now, Western population has about 1% of vitamin C deficiency. In other populations, for example, India, there is 66% vitamin C deficiency. So why vitamin C in hypothyroidism? There's been only 2 studies, one with 31 patients and one with 28 patients. Both of them were not randomized, and they both implicated that TSH can improve, patients feel better, and they put it down to gastric pH improvement. So what we wanted to do was, first of all, look at the vitamin C levels in our population. How does it vary for normal people who don't have hypothyroidism and for people who do have hypothyroidism? And then we wanted to actually do a randomized controlled trial in patients with levothyroxine, more than 1.6 microgram per kg per day, give them vitamin C and placebo, and to see if actually there's a difference. And we wanted to make sure that it's not the pH effect or a gastric effect. We got our ethical approval, and we registered it as a trial. The part 1 was probably easier. We actually had to find adult patients who had hypothyroidism, who were taking more than 1.6 microgram per kg per day, and who didn't have a secondary thyroid problem, and who didn't have a gastric problem. Out of 600 patients, we could only find 36. 26 agreed to do the study. The control group was university students. Because we cater to students from all 7 Emirates, so it had good representation of all the Emirati population, although all of them were in young age. Adequate levels were taking more than 50, and the bloods were analyzed at our college. Now, 26 patients from the hypothyroidism group and 91 healthy students, we all had their vitamin C levels done. What we found was 5 patients from the hypothyroidism group, so 5 out of 26, they had low vitamin C levels, while in the control group, you had 7 patients who had low vitamin C levels. So overall, you have 9% hypothyroidism and normal combined who have got lowish vitamin C levels, but it was much higher in the hypothyroidism group, 19% versus 7%. So then we moved on to the pilot trial. We offered all these patients to get onto the trial in which we would give them a masked drug. So that was a bit scary, so not 26 patients participated. We wanted to give them vitamin C. We wanted to give it similar sized, similar taste tablets. So we had to choose ORS tablet as a placebo and vitamin C orange flavor tablet as the medication. We were using 1 gram, and we did the thyroid function levels at the start and at 16 weeks. While selecting the vitamin C and placebo, we took the normally available ones in the market and we compared their pH. And those that had the closest pH match were the ones that we selected. So the pH difference was not much, as you can see, 4.86 and 5.01. Our outcome was to look at the thyroid function levels before and after. Was there any change in TSH? And the Zalewski score. We chose Zalewski score because it's freely available, and plus it kind of gives us a good quantitative idea or objective idea of how patients feel. 12 patients participated in the study. We randomized them by random number generator. This is the Zalewski score. Score of 5 or more is considered symptoms of hypothyroidism. The baseline characteristics, you can see that maybe the placebo group had a slightly higher age, higher weight. TSH-wise, maybe treatment group had a slightly higher TSH, but otherwise they were quite similar. We gave them blue and black containers. So the black containers had vitamin C, the blue containers had the placebo ORS tablets. One patient was lost to follow-up in the placebo group, so we left with 5 and 6. They were followed up every 8 weeks, and we provided them vitamin C and placebo, and we looked at the Zalewski score and the TSH levels. What we found was the group showed, who were on vitamin C, improvement in the Zalewski score by at least 5 points, as compared to placebo group, which was 1.4. Because it's a small number of data, we only used Wilkinson sign rack tests to get a value, and our p-value was 0.07. The TSH also changed with a p-value of 0.05, improvement of 4 in the group who was taking vitamin C, and improvement of only 2.35 in patients who were taking placebo. So there was improvement, probably related to compliance, but there was no pH difference, so we think this is all because of vitamin C. So this is the data. As you can see, the negative shows that they're going in the negative direction, so TSH is improving. And Zalewski score, again, there was improvement. And both of the values, p-values, were significant. T4 did improve, but it didn't improve significantly to create a p-value that was significant. So what we showed was all these patients, they had improvement in the clinical symptoms as per the Zalewski score, and the improvement in the TSH on the same dose of levothyroxine. Anybody who had increase in the dose of levothyroxine was excluded from the study. So basically what we found that vitamin C supplementation can actually enhance the levothyroxine effect. We don't know why, but it's not the gastric effect. It's not the pH effect. It's something to do with vitamin C, whether it reduces or makes the levothyroxine more easily absorbable later on in the small intestine by interacting it at the gastric level. We need more studies to do that. This audience is full of thyroid specialists and expertise, so maybe we need to collaborate and do a bigger study all around the various countries in the Arab world to get that results. But this is a very simple and cost-effective way to improve TSH levels if it works in a larger study. Yes, there is limitations. It was a very small study. It underpowers the results. We never asked them about how their dietary vitamin C was. We couldn't assess that part. We didn't assess their gastric pH or any gastrointestinal conditions, although we ruled out everybody who had celiac disease or who was under the follow of gastroenterology. We didn't specifically look into that. And at the end of the day, it was a single center, only from Tawam Hospital, so it may not be representative of the broader population. I'll leave you with the question, what's common between these animals and humans? And that's me.